let's dive in to reopening the economy and how we can accomplish that effectively and why it's necessary even if the pandemic persists. Let's discuss it with Avik Roy, who is president of the Foundation for Research on Equal Opportunity and co-author of the Foundation's A New Strategy for Bringing People Back to Work During COVID-19, a report that they came out with at FREOPP. And Avik Roy joins us now. Avik, sir, welcome to the show. It's good to have you.
Hey, thanks for having me, Jimmy.
Thanks for coming on. So let me ask you kind of a big picture question for starters. In terms of the reopening, we have the debate going on about whether or not to reopen, what's involved in that and so forth. What's your big picture perspective on the need to reopen? And I understand regardless of what happens with the pandemic.
Yeah, so our paper basically has 2 points. There are 2 points that we make. The first is that there's this conventional wisdom that, well, we can only reopen the economy after we've scaled up testing and we've developed an effective treatment and we've gotten immunity and we have a vaccine. The problem is we could fail at every single one of those things, particularly in the near to mid-term. And that leads to the second point, which is that we cannot have the economy locked down at these levels for months on end. In fact, every week that goes by, small businesses around the country are closing because they're running out of cash reserves. So we have to get the economy reopened as soon as possible, and we have to do so in a careful way so as to continue to protect public health.
Now, in terms of the reopening question, I mean, there are a lot of people who are saying, and you alluded to this before, we need to meet certain testing metrics. We need to meet certain metrics when it comes to how it's being spread and what policies are put into place as far as social distancing and how effective those policies are working in particular areas. Much more intricate, even to get to the point where you can start widely reopening the economy. What do you make of that? And are those metrics tenable? Can we wait that long in some of these places? Or do we just need to start moving forward, although, as you point out, in a thoughtful way?
Well, there's a lot of oversimplification going on, particularly in the press, about testing. So, people, when you tell an average person, oh yeah, you get tested, they think of it as like getting your blood type tested or having a pregnancy test, tests that we know that have been around for a long time, that are super accurate and super easy to use. Testing for coronavirus is very different. Not all tests are the same, and not all tests are equally accurate, and not all tests actually measure active infection. There's certain types of tests that measure whether you're currently infected, but don't tell you if you've been infected in the past. There are other tests that tell you if you've been infected in the past, but don't tell you if you're currently infected. So you might actually test negative for COVID and be infected, because it takes 3 to 4 weeks for your body to develop antibodies to the virus that you're infected with. So for all these reasons, when people say, oh, we just need more tests and that'll solve everything, that's totally wrong, because there are a lot of tests that you can get that may falsely reassure you that you're disease-free, but you are actually infected and are going to get sick later on. So for all those reasons, testing is not going to be feasible at the population level. If you have all these people saying, well, we just have to have 2 or 5 million tests per day and then we can test the whole country every day for coronavirus. Well, it's not going to work that way, because the tests that can actually test active infection involve these 6-inch nasal swabs that go up your nostril to the back of your head, and then you get this test 2 days later saying you're positive or negative. Like, you're not going to have 2 million Americans lining up for that service every day.
Again, Avik Roy, our guest here on Jimmy at the Crossroads. So when we look at some of these metrics that have been put forward, I mean, obviously the testing is one point that people consistently raise that we need to have, and you just addressed that point. But are there any other metrics that you hear bandied about quite a bit that maybe we need to take a closer look at before people say, well, this is something we need to use as a determining factor of whether or not to reopen?
Yeah, so you'll hear Anthony Fauci, for example, often say, well, if everything goes well, we'll have a vaccine in 12 to 18 months. There is absolutely no assurance that we'll have a vaccine in 12 to 18 months. We've been working for 35 years with the most brilliant scientists in the world to develop a vaccine for HIV. We still don't have one. We've been working for longer than that for a vaccine for hepatitis C. We still don't have one. We've never developed a vaccine for a novel coronavirus. The common cold is actually a coronavirus. We don't have a vaccine for that either. And there are a lot of technical reasons for that the virus mutates too often to create a vaccine that can last. But the point is, this idea that we're just going to bake a cake and snap our fingers and all of a sudden we'll have a vaccine, that's not necessarily true. And it's also not necessarily true that despite all the efforts from the pharmaceutical industry or the biotech industry, that we're going to have a treatment that wipes out the virus in your system in the next couple of weeks or months. We may get one in a year or two, but in the short term, we can't guarantee that. And again, it all comes back to how long are we going to keep 20 to 30 million people unemployed? How many trillions of dollars a month are we going to spend of our grandkids' money to keep the economy propped up while we wait for those things? We're going to run out of money soon enough, and we're going to run out of people who can continue to stay unemployed and on the economic sidelines.
The noted Nobel Prize-winning economist and New York Times columnist Paul Krugman came out with a new piece for the New York Times this week, and he said that this retreat from responsibility, that is the rush to reopen, won't just kill thousands. It might also turn the COVID slump into a depression. Here's how it would work, he writes. Over the next few weeks, many red states abandon social distancing policies, while many individuals taking their cues from Trump and Fox News begin behaving irresponsibly. This leads briefly to some rise in employment, but fairly soon it becomes clear that COVID-19 is spiraling out of control. People retreat back into their homes, whatever Trump and Republican governors may say. So we're back where we started in economic terms and in worse shape than ever in epidemiological terms. As a result, the period of double-digit unemployment, which might have lasted only a few months, goes on and on. How do you respond to that one, Avik Roy?
Well, if there isn't a website that compiles all the insanely wrong predictions that Paul Krugman has made about the economy,
so true.
Should be, maybe you need to do that, Jimmy, and enlighten the rest of us with all the confident things that Paul Krugman predicts that never come out to be true. And the key point here, Jimmy, is that Paul is exactly wrong. The people who are arguing that we have to lock down the economy forever in order to fight COVID-19 are the ones who are ignoring the science. They're the ones who are ignoring the evidence. In fact, we have lots of evidence and lots of science from around the world as different states and different countries try different strategies in terms of how to prevent an overwhelming of our healthcare system from this disease. And there's been a lot of success with lighter touch strategies. I'm sure on your show you've talked about Sweden. Sweden is a country where they didn't completely shut down. It's not like they did nothing. They did ban sporting events. They did ban bars, crowded bars from serving people. But in general, they let the economy continue. And they found that there was no apocalypse. There was no spike in infections. They do have infections. They do have disease. But it's in the range of other European countries. And there has not been an apocalypse. In Florida, Governor DeSantis has been so heavily pressured to completely lock things down. He didn't. He let breakout regions like Miami-Dade County lock down, but rural areas didn't have to. That worked reasonably well. The idea that just because the New York subways are places where a lot of people are getting infected, that the rest of the country has to have the same policies as New York, that's the thing that's insane. That's the thing that's irresponsible. And tens of millions of people are losing their livelihoods because of irresponsible rhetoric from people like Paul Krugman.
Avik Roy is our guest. He is the president and founder of the Foundation for Research on Equal Opportunity. And I want to ask you, before we shift into what you guys are proposing as sort of the plan for reopening to do this effectively and safely, I want to ask you about sort of the trajectory that we've been on, not just economically, but also socially, many of the social consequences that come from this. I mean, it seems to me that public health officials are just narrowly focused, somewhat, I guess, understandably in a sense, but still narrowly focused on let's address COVID-19 and do whatever restrictions we think are maximally necessary in order to not just flatten the curve, but as Paul Krugman says, crush the curve. However, Not only is there economic fallout that they don't seem to be taking into account, but there are also a heck of a lot of healthcare issues where people are not seeking treatment for other significant problems they may be facing, delaying treatment. Also, there are increases, it seems, in child abuse that's happening and going unreported because it's not being noticed at schools, for example. Maybe spousal abuse, depression, anxiety at fever pitches. I mean, there are so many social consequences that can really last a lifetime. And yet it doesn't seem to me that a lot of the advocates for an indefinite closure of our society are paying attention to that. Avik.
Well, it's absolutely true, everything you said, and more. Imagine the person whose cancer gets diagnosed after it's already spread to the rest of their body because they sat at home for the last 2 months. And so those are the kinds of deaths that are not going to be counted in the official statistics, but they're just as real and just as tragic as those from COVID-19. And by the way, there's something else that we should talk about we haven't touched on yet, which is that, we just put out a paper on this at freopp.org, our website, FREOPP.org. 40 to 50% of all the deaths from COVID-19 in the U.S., and by the way, in other countries, have occurred in nursing homes and other assisted living facilities. 1.6% of Americans live in those kinds of residences. And yet 40 to 50% of all the deaths are occurring in nursing homes and other residential care homes. That's tragic for a lot of reasons because a lot of state governments, New York and New Jersey in particular, forced nursing homes to accept COVID-19 patients to keep hospitals clear of those patients. And that led to the outbreak and spread of the disease in nursing homes. The silver lining of that tragedy is that the risk to everyone who doesn't live in a nursing home is actually significantly lower. And it gives us more reason to consider reopening the economy, particularly for school children who can go back to school and younger workers who can go back to work.
And it gives us a guiding point, I would say, Avik Roy, for how best to go about this reopening. I think that's the perfect jumping off point to delve into that discussion because it's not like you or I or anybody just about is saying just open everything up completely, don't worry about any guidelines, anything along those lines. There are ways to go about this smartly, strategically. Give us a 50,000-foot view of what the Foundation for Research and Equal Opportunity is talking about.
Right. So we touched on it a little bit. So the key thing in terms of the reopening is to know and to understand the evidence and the science, which is that COVID-19 is a disease that overwhelmingly affects elderly individuals. That doesn't mean you can't get infected if you're young. That doesn't mean you can't get sick if you're young. But it means the risk of severe illness and death if you're young relative to if you're old is a big, big difference. Based on the data from the Centers for Disease Control, if you're over 65, your risk of dying from COVID-19 is 25 times that of if you're between the ages of 25 and 54. And if you're younger than 25, your risk of dying from COVID-19 is almost zero. It's like 3 in a million. So all that to say that we should look at that evidence, we should look at that data and say, yes, look, we should take precautions. We should clean our surfaces. We should engage in social distancing. We should engage in deep cleanings. But we can allow kids to go back to school with minimal risk to the hospital system and to death. We can let younger people back into the workforce with minimal risk to hospitalization and death. Now, of course, we should make sure that older teachers and at-risk individuals have the ability to stay home. We should make sure that kids who live with their grandparents don't necessarily go to school and get exposed from COVID-19. So you have to make those exceptions. But the majority of people can go back to school, can go back to work, particularly younger people. And that's one of the ironies of this whole thing, Jimmy, is that this is a disease that primarily adversely affects people over 65, but the working age population is primarily under 65, and those are the people we're forcing to stay home and not earn a living.
So when we look at the idea of sort of making a generational determination on who goes back and who doesn't, how do you think that can work functionally? Because we're in a society where you're supposed to be treated equally under the law regardless. So how do you see that being done from sort of a legal standpoint, Avik Roy?
Well,
are there any challenges?
Winston Churchill once described capitalism as the unequal distribution of wealth and socialism as the equal distribution of poverty. And this is effectively what we're talking about here. We're actually talking about people who are saying, well, if some people can't go to school, then nobody should. Mm-hmm. And that doesn't make any sense.
Right.
Those elites are saying, if you have a single mom who's a pharmacist who can't go to work because her 5-year-old would be left alone at home, that she should stay home, that her kid shouldn't be able to go to school. We should make sure that those kids are going to school. We should make sure that every kid who needs and can take advantage of the opportunity to go to school and go to work, and adults who go to work, that they can do so. And yes, for other people who need extra layers of protection, we protect them, and we ask them to stay home. But for everybody who can go to work to get that economy going again, they should, because their lives are at stake, their livelihoods are at stake, as well as everyone else's.
Now, when it comes to workplaces and enforcing these sort of social distancing guidelines, I was fortunate enough yesterday to get a haircut. And I went to a local Sport Clips, and I was remarkably able to get in there in about an hour, having checked in online. And I had to wear a mask, and when they got around my ears, I had to take off the ear hooks from the mask and hold it up to my face. And then when I went back and did the hair wash, whatever, then there was a process in place for that. And I was talking to the stylist, and she was telling me that she's so glad to be back to work. She thinks that the shutdown was excessive, didn't think that it was particularly appropriate, and she also is really pleased with how Sport Clips is handling it from a deep cleaning standpoint, for making sure that the facility has a process in place for protecting people to the greatest extent possible. And I felt more comfortable when the worker there was feeling very comfortable with what was going on, and also relieved to be back to work. And I think that provides some guidance for us, Avik, for how we should be reopening and how best to go about that as well.
So many points to make based on that story.
Mm-hmm.
The first is that, this impression that the Paul Krugmans of the world have, that somehow we're just going to go back to normal if we reopen the economy. No. Everyone is aware that we have to do a better job in terms of making sure we're washing our hands and using social distancing and all these different tools to make sure that we're being careful. And businesses in particular have a massive incentive to reassure both their workers and their customers that their workplaces and stores and establishments are safe. So you're not going to need to pass regulations to do that. People are going to do that on their own, because if they don't do that on their own, customers are not going to go to those hair salons or those restaurants. So that's an important thing to take advantage of. And by the way, another argument I've heard, particularly from people who live in Washington, D.C., is, well, there's no point in reopening the economy because people will be too scared to go to a store or go to a restaurant or go out. And, yes, there will be some people who err on the side of caution. But others are eager to get their hair cut and get a bite to eat with their spouse or loved one. And those people who actually do that, and as that happens and the cases and hospitalizations and deaths don't spike, that will be the only thing that can restore the confidence of those more cautious individuals to take that doctor's appointment or get that haircut. So if you cannot reopen the economy completely without reopening the economy partially.
I think that's such an important point, Avik Roy, and I look at it, too, from the standpoint of liberty, making it possible for businesses and individuals to make the determination whether or not to reopen, whether or not they want to go to a restaurant or what have you. But then also, it works in favor of the idea that the reopening will be a bit slower automatically, just by nature, because people will be taking their time, they'll be judging the circumstances, and that should give us hope that we can reopen effectively, at least get the economy started again, and then trust that people will be responsible when measuring their own risk.
That's totally right. And especially when you consider the huge variation in how COVID-19 has affected different parts of the country. The way we handle this in rural areas or in regions that aren't as badly affected should be very different than the way we handled it in New York City, where, again, you have a subway system. You have other things about New York, the way they've mismanaged their nursing home population, that affect the way you deal with the infection in that area and in the Eastern Seaboard in general. So it's really important to look at this regionally. It's very important to look at the evidence. It's very important to understand that coronavirus is not the flu. And what I mean by that is all the public health authorities are basically using these scripts, these playbooks that they're dusting off from past pandemics of the flu. And COVID-19 is not the flu. It's a different disease caused by a different virus, and it requires a different strategy.
Although one thing that strikes me about this situation is that while they may be using certain things from a playbook, we've never tried this playbook before of shutting down an entire economy virtually, Avik. This is unprecedented in terms of putting healthy people, young people, everybody, and saying, you all need to stay at home. That seems to me to be a bit of a different playbook, though.
Well, it's different in certain ways, I suppose, than things the U.S. has done in the past. But it is very much the playbook that is taught in every public health school about what you do in extreme flu pandemics. If you study the history of the Spanish flu of 1918, the lesson that most people in the public health world draw from that is, we should lock down the entire economy and then wait. And then you can start to gradually rebuild things. And again, Sweden, as we've talked about, Sweden didn't do that, and Sweden is just fine. Florida didn't do that, not to the same degree anyway, and Florida is turning out to be just fine. One thing, for example, that we're learning about COVID that's different a bit from the flu is outdoor transmission is much less likely than indoor transmission. The transmission of that virus, of the SARS-CoV-2 virus, seems to occur in tightly enclosed spaces where a lot of people are crowded together. It doesn't seem to occur in brief encounters, it doesn't seem to occur in less dense spaces, and it particularly doesn't seem to occur outdoors. And yet when DeSantis refused to shut down the beaches, everyone yelled at him. Well, it turns out that he was right, that transmission in the beach is not actually that big of a risk. So there are a lot of things like that where we can learn how COVID is different from the flu, and that can help us reopen the economy. Because again, our goal is not to sacrifice public health in terms of reopening the economy. It's to find that sweet spot, that low-hanging fruit of things that we can do that are minimal in terms of their risk to public health, but maximal in terms of their impact on the economy.
Yeah, the idea that reopening is necessarily going to be averse to public health and to addressing the virus is just patently false when you look at reality and how both can go hand in hand. Just wrapping up, just two final quick questions. Since you mentioned 40% of the deaths we've seen have been in nursing homes, what do you think needs to be done in order to address those facilities and stop the spread there and contain it better?
A great question. We have a whole section in our FREOPP paper on this topic. First, we have to do what a number of states are starting to do, which is restrict visitations to nursing homes to make sure that people, even family members who might be infected but don't know it, can't infect nursing homes and the people who live there. The next thing that's really important is you've got to make sure that the people who work in those nursing homes are sticking to a particular institution. What happens at a lot of nursing homes, particularly ones that are part of bigger chains, is you have a group of people on the staff who work at multiple nursing homes, and so they basically are the ones spreading the disease from nursing home to nursing home. So you have to find ways to restrict them to one nursing home and hire other people to handle the other nursing homes, and of course test everybody aggressively all the time who's working in those nursing homes and living in them. Those are some of the key things that we have to do. And one other thing we can do, so New York, New Jersey, Michigan, a bunch of other states used to have had these mandates where if you were discharged from the hospital with COVID-19, nursing homes were forced to accept you and take you in. Well, of course, what did that do? That spread COVID-19 to all the nursing homes. So you have to rescind those mandates, and you have to use maybe some of this excess hotel capacity, since nobody's traveling right now, to house those individuals until they're fully cleared of the virus. And then you can bring them back to the nursing home.
I want to ask a fundamental question finally here with you, Avik Roy, again, our guest, founder and president of the Foundation for Research on Equal Opportunity. And that is the lesson we should learn from this crisis. And I've been asking different folks this question. There are some who say this underscores that we need a new deal, that we need a massive expansion of the government in order to address crises like this and provide for the people into the long-term future. And therefore, the lesson is we need more government. Versus the other lesson, which is government is incapable of fully addressing these in a very intricate way. And we need to recognize that we cannot simply rely upon government, and we need individuals to be able to have the latitude to take initiative of their own accord. I mean, I look at trust in institutions in this country right now. We have a credibility crisis in our institutions across the board. And I think for me, I've never trusted government less than I do right now. And I think that's the case for a lot of Americans. And those Americans like me are looking and saying, you want us to trust you that you're going to have all of our best interests at heart and that all of this is going to work when I can't trust you in general right now. So how do you weigh that lesson and what people should take away from this crisis of the coronavirus, and then what you think people will likely take away?
Well, Jimmy, it's a great question. I think the honest answer is that it doesn't fall neatly into ideological categories. There's no doubt that the government is a big part of the reason why we're having this pandemic in the first place. If you think about the way the Centers for Disease Control and the way the FDA went out of their way to prevent people in Washington State and others from developing their own tests to track the people on the early side who had this disease. That was a huge failing of the government, of the bureaucracy. And there have been huge failings all the way through, like we've talked about New York and New Jersey and these mandates to force nursing homes to accept infected patients that helped spread the disease. There are a lot of experts that have advised the government who've been totally wrong in terms of their projections about how this disease will progress. All those things point to incredible disaster in terms of government legitimacy and correct government action on all this. But when it comes to public health crises, there is a legitimate role for the government in helping to facilitate the scale-up of testing and vaccines, to fund scientific research that helps us identify what's going on, right? So there is a role for government, but it's just a very different role than the one that we've seen up to this point.
I think that is the only real answer you can be looking at, which is government can be effective in certain particular areas versus the idea that we should, for example, expand to a Medicare for all program. I'm not going to get you off on that track because I know we could do a whole other half hour on that. But nevertheless, it is important to keep in mind that while there are a lot of things we should not be looking to government for, there are some narrowly tailored things that absolutely we can learn as being appropriate roles for government. Avik Roy, again, President, CEO, founder of the Foundation for Research on Equal Opportunity. So great to get your thoughts here today. I hope folks will check out FREOPP.org, FREOPP.org, so that they can check out the report. Thanks for joining us.
Hey, thanks, Jimmy.
Once again, Avik Roy joining us here on Jimmy at the Crossroads. Always a pleasure and a privilege to get thoughts from thoughtful people who really understand public policy, who understand the role of government, who understand that government is not something that has incredible potential to just do everything. You just watched a clip from Jimmy at the Crossroads. Don't miss more engaging, intelligent talk. Subscribe to the Jimmy at the Crossroads YouTube channel today. You want to catch our live show. And I love your support.
I got Jimmy at the Crossroads, making sense out of no sense. Yeah.